Lori from Women's Health on the Go. Welcome to our show. If you've been here before, welcome back. If you're here for the first time, welcome. Every week at 8 o'clock on Monday night, I come here and I talk to you guys about lots of women's health issues and also just about how to take care of ourselves naturally and holistically. Tonight, I've had a couple of requests to talk about mammograms. Mammogram guidelines. What do we do? Do we start getting mammograms when we're 40? Because there's so many different organizations out there that they're all coming out with different things. And I'm going to say a little comments about some of them, but that's all confusing. And what are we going to do? And we're going to go over all that. First off, the one thing that we really need to kind of determine before you can actually say, should I start getting mammograms early or not, is determining what your risk is. You know, if you don't have any family history, depending on so the longer you're exposed to estrogen, the more likely you are to possibly develop breast cancer. So if you get your period when you're really, really young and then go through menopause and you're really late, and then maybe you suppose you don't have any children, you're probably going to be a little bit of higher risk of someone who started late, started menopause early, and who have had a couple of children. So, and also then if you've ever had other kind of, if you've had ovarian cancer, if you've had any kind of cancer down in that peritoneal area, if you're positive, let's suppose you had a family member who had breast cancer and they were what we're going to talk a little bit about this, a BRCA, which is a gene that can tell you your risk. If you're positive for that, your screening is going to be completely different. So just to start off right away, everything that I'm basically going to be talking about is for someone who has low risk. Okay. Now I'm going to put, I'll put a link up in the description at the end. There is a online, it's called the Gale Risk Assessment, which you can go on and you can go through all of the kind of questions, and it'll give you the percentage, your risk factor of actually developing breast cancer. Now, it doesn't talk about your survival rate. It just talks about the chances of you actually getting breast cancer. But it's really great. It goes over like your age. Do you have kids? When did you have are you in menopause? Do you have anybody with family history? It goes through all these things and it kind of calculates it for you. So I will definitely put that. It's called the Gale Risk Assessment. I will put that up in the description so that you can. I wonder how I can't comment right here right now. I would think that I got this new system here and I'm just kind of rolling with it here. So let me see. I can actually put this, I'm going to actually put this right in the comments right now. And then if you wanted to check it out while we're talking, you can do it. But if you can keep an eye on me while we're doing this, that would be awesome, because I'm actually going to be showing you. I'm going to paste that right now. And okay, so I just put in the comments the breast cancer risk assessment tool. Okay, like I said, it's very, very easy to do. Just a few questions. It's literally like drop downs, and it'll give you your risk. Okay, now if you have family history, and like I said, so if you have family history, typically nowadays, if someone develops breast cancer, okay, typically after, they'll do actually blood tests and genetic testing on them to see if they're positive for what we call BRCA gene. Okay, there's 2 of them. And if you have that, that's something that's hereditary, that puts you at a higher risk of not only breast cancer, but ovarian cancer. Now, let's suppose I got breast cancer and I had children. And so I would get that testing done so that my children can know whether or not I'm positive or not. Then they can make the decision of whether they want to get genetic testing when they get older, when they get to that point. Now, the one thing that when I talk to patients about when they have family history, and mind you, sometimes people have not had that BRCA testing, depending on, well, there's lots of, there's lots of reasons that may possibly they did not have, or you might not know if they've had BRCA. So if someone has family history and talking about mother, aunt, sisters, I will typically go, did your family member get tested for BRCA? And if they did and they're positive, okay. And then there's also, if they haven't been tested, then okay, would you like to go for genetic counseling? Okay. And what I say to patients is that what do you want to get out of this information? Because it's almost like I hate to say the word like a loaded gun, but when you get that information, you have to be prepared for it. If you are positive, what does that mean? What does that mean for you? What are you going to do? I mean, we've seen, celebrities who've actually got radical mastectomies to help kind of prevent that from happening. But I really say to people, you really, really, really need to know what you're going to do with that information before you actually go for genetic testing and counseling. Because it's something that it's a lot of information to take. If you come out positive, what does that mean for you? What are you going to do about it? Are you prepared for that positive? Hopefully that kind of makes sense. Okay, so those are the high risk, and usually typically if you're getting high risk, your mammograms are going to be, they typically have them, you're doing mammogram and breast MRIs, and you're doing them 6 months apart, so you're getting screening every 6 months. And then it also depends on when was your family member diagnosed. It's something that if someone has really significant family history, I actually refer them to the specialists. I refer them to the specialist to do all of the genetic talent testing and screening and everything. And a lot of them, it's almost like an oncologist to really do their screening for them. Okay, so let's talk about people who have low risk, okay, which is the majority of people. Now, what I want to do, hopefully this is going to work. Hi, Nancy. How are you? We're talking about mammogram screening guidelines, so welcome. Okay. I'm going to show you, let's see if this kind of works. I think it will. It'll all work out pretty good. Okay. Oh, it did. Yay, everyone. Okay. What I want to do here is, all right. Hopefully you can see here. Okay. Let me just bring that out a little bit. Okay. Over here, you can kind of see, now where I got this from is what we call up to date, okay? I think the majority of medical providers has access to up to date. It's a very expensive prescription. It's about $500 a year, but it has all the updated research, all the updated guidelines. They're constantly updating them. You name it, they have the information on here. And a lot of us, when we're not sure what guidelines are going on, this is where we go to look at the guidelines, okay? Now, so this is a chart that they have on here about the different organizations and the different mammogram recommendations. Now, as you can see over here, these are government-sponsored groups, okay? You have United U.S. Preventative Service Task Force, which is a very, very good organization. Very, very good organization. And this is the guidelines that I like, actually. Then you have the Canadian, you have the NHS, which is in the UK, you have the Royal Australian College, then you have medical societies, you have the American College of Obstetrics and Gynecology, the American College of Physicians, so you can see all of the different organizations, okay? Now, this is where I really want you to, let's see if I can do this correctly again. Okay, this is where I really, really want you to see, okay, right here, okay? And that's this 40 to 49, okay? Because I think this is the area that most people are confused about, okay? Because the guidelines keep changing, and as you can see, all of them have different guidelines, okay? I like the U.S. Preventative Service Task Force. They're just neutral people looking at all the data and saying, you know, this is what we think is the best. And what I like about them is it's individualized, okay? I think that between 40 and 49, this is something that you really should have a conversation with your medical provider with. You have to look at your risk factors, going to the GAL risk assessment and seeing your risk factors. I don't mind sharing you mine. I put in now, my risk is 0.9% risk, okay? And I had a mammogram once, a couple of years ago. I can't remember how old I was. And I'm 46 years old. And I decided, based on all of this and based on my risk factors, I had one as a baseline. And I personally have made the decision that I will wait until I'm 50 to do my next, okay? Because I think it really is an individual. Now, you can even see here, now this is the Canadian, the second one is Canadian. They say they're recommend against it. And we're going to go a little bit more into mammograms and, the risks associated with doing mammograms, and that may help you make a decision a little bit better. But, I think that that's something, initially the United Preventative Service Task Force, it's like a tongue twister there, they actually didn't recommend really having those mammograms until 50, but then everybody made a hoopla on it. From what I understand, they kind of changed to being individualized. And I personally think that if you feel comfortable with, if you have no family risk, and if you want to wait until you're 50, if you notice, everybody, when it comes to being 50, everybody recommends that we need to start getting guidelines. Maybe not every year. Again, look at the U.S. Preventative Task Force every 2 years. Look at every 2 to 3, every 3, every 2, okay? It's only the obstetrics and gynecologists, which is the American College of Obstetrics and Gynecologists again, the American College of Physicians, and no wonder, the American College of Radiologists, because, you don't want them to be out of business, do you? They recommend every year. So, again, I think that this, to me, is very individual, okay? When you look down here, there's these American, the ACOG, the radiology, they still think that you should start getting them at 40 years of age, right? And we're going to go over a little bit, and that may what I'm going to talk to you about, the risks with mammograms, may kind of change your mind. I don't know, okay? But I think that I just really wanted you to see this chart, to see all the different organizations and what they kind of recommend. The American Colleges of Obstetrics, I'm just going to call them ACOG because that's what we call them. ACOG, yes, I work in the GYN field, and their guidelines are always, I feel like, yes, they do follow guidelines, they do follow some research, but I also think that there's also that financial initiative, just like the American College of Radiologists. If you don't go for your yearly mammograms, what are they going to do? That's just the bad side of me, I guess you're talking about it. Again, I think this is something that's very individualized. When you're coming from 40 to 49, and if you're very low risk, I think that this is something that should be very individual. Now, I will tell you that I have some people that come to me, and no matter what, they don't care. I always say, listen, let's talk about it. Let's talk about your risk. Let's do the GAL risk assessment. Do you really want to do this? Do you not? Let's go over this. And some women, they have no risks, but they still want to get their yearly mammograms. And that is their decision. It's, me as a healthcare provider, it's my job to provide you with all the information. But at the end of the day, this is your body. This is something that you have to make the decision for yourself. Hopefully that makes sense. Okay? So hopefully those guidelines, okay, Susie's quick asking, so do most doctors in America follow the first guidelines, and should I ask? I think that you have every right to say, I think it really depends, Susie. Okay, so what is your provider saying to you? If your provider is saying to you, you're 40 something, you need to get a mammogram every year, well then they're not following the U.S. Preventative Service Task Force. I would say most gynecologists will follow ACOG guidelines, no fault to their own. I mean, that's almost like when it's a tough kind of call sometimes, I have to say, working in this field. Most providers will follow ACOG guidelines. There's the whole debate. I can go on a whole side debate about should women get pelvic exams every year, even though there's not pap smears every year, which we're going to go a little bit further into a little bit later. In all the years that I've been doing this, have I found cancer or anything bad from someone coming in from a routine GYN exam? I don't think so. I mean, it's very rare that you're going to find something. So we're going to talk a little bit about that later. But ask. Absolutely. You have every right. This is your body. This is your life. And just saying, hey, what guidelines are you following? And I probably, in all likelihood, they're going to tell you they're following ACOG. And you can ask them about the U.S. Preventative Task Force Service. It's too many words there for me. But anyway, definitely ask. And you know what? At the end of the day, you have the right to, even if your provider says you should have a mammogram every year, you should say, well, it's my choice, based on my research and the guidelines that I've read, I want to wait. And you have every right. At the end of the day, this is your body. This is your life. Absolutely. I hope that makes sense. Okay, so what are risks of getting mammograms? Well, if you think about it, every time you get a mammogram, you're getting a little bit of radiation exposure, okay? So the amount that you're getting when you have one mammogram is really tiny. What is it going to do? Not much. But if you're getting them every year, there's this whole, I don't know if it's a theory or discussion that, because of the way that the tissue is in your breasts, it just keeps sucking it in. And there's some people that actually believe that with repeated exposure over year, well, eventually, you're going to get breast cancer because you're exposing yourself to radiation. Okay, there are people, and there is that risk of even like chest. They even talk about even if, let's see, if you've had X-rays, multiple X-rays, which is again a very low dose radiation, but if you keep getting X-rays, but you're also getting mammograms, you're gonna be exposing yourself to a little bit of radiation, and that's not going to be good. Okay, mammograms, they're not always accurate, depending on the tech who's doing it, depending on the radiologist who's reading it, and then most of the time, about 10% of the time, they're going to see something, and then they're going to be like, oh my gosh, it looks abnormal, get a biopsy. You're freaking out, right? You're freaking out, oh my gosh, I have to get a breast biopsy, I may have breast cancer, and the majority of the time, it's negative, it's nothing. Now, do they find cancer? Yes, they do, but we're going to go a little bit into they do, but there was an article, gosh, must have been, I don't know, don't quote me, 3 or 4 years ago, and it was just talking about how, do mammograms really, how good are they? They're as good as they are. They're not the best way to be detecting breast cancer. Can they find things that are cancerous? Yes. What do the majority of people? They find it themselves, okay, doing breast exams on themselves. So unfortunately what will happen as well is you're going to get additional testing, and sometimes it's going to overdiagnose, and then you're going to be over-treating yourself. So that's another whole, we can have a long discussion about that as well, okay? It cannot detect all cancers. 1 in 5 cancers are missed by doing just a mammogram. So you got to do that with those. You got to do breast exams on yourself. There was this whole thing too about they're kind of changing some of the guidelines with doing clinical breast. Getting a clinical breast exam every year, but doing what we call BSE, breast self exams. And they're saying, you shouldn't be really doing breast exams on yourself because this is actually pretty kind of funny because they say, what if you find something, half the time it's benign, and then you have to have all this testing. Well, it's not the same thing with mammograms. Like sometimes people are finding stuff on mammograms. They're going through all of this rigmarole of getting biopsies, and then they're ended up being negative. Now, I'm not saying that no one should go out there and get mammograms, but I think it's things that we need to think about, okay? I'm hoping that I'm making complete sense here. Give me a yes if I'm making sense to everybody out there, just so I know I'm not losing anybody here, okay? Another thing that can happen with mammograms as well is that how it cannot actually detect things really good is you have what we call dense breasts. This is how I describe dense breasts. I always find something to do with life, and that's how I try to explain things to patients. Okay. The forest in the winter has no leaves on it, and you can see through it perfectly, okay? That's a mammogram that can typically see everything. Dense breasts is when it's summer and there's all these leaves on the tree and you can't see through the forest at all, okay? So if you're in the forest and there's all these leaves, you can't really see, you might not see that there's a bear all the way on the other side or something because you can't see through there, okay? So it's almost the same kind of concept with a mammogram. If you have dense breasts, and they do a mammogram, and if that breast cancer is in the middle of the forest, it's not going to see the cancer. Okay. Now there have been some laws in a lot of states. I know in the state of New York, if you have dense breasts, the patient needs to be notified saying that your mammogram appears to be normal, but your breasts are dense, and the recommendation is that you have an ultrasound. Now, according to Up to Date, if you're a high risk population, your screening is going to be completely different, and that doesn't pertain to that. But they say that the research shows that doing extra testing, ultrasound and stuff like that, it's not really going to be very helpful. And I know in the state of New York, because that's where I am, you'll get this letter saying your breasts are dense, and that the mammogram might not be to be able to detect everything. And if you want, you can have an ultrasound. But insurance companies, depending on what insurance company you have, don't cover it. So if you want to have that extra testing that the radiologist is kind of telling you that you need to do, you're going to have to pay out of pocket for it. So hopefully that makes sense. I mean, it doesn't make sense, but hopefully I kind of explained that when it comes to dense breasts. And, okay, hold on, let me say. So Susie says, you aren't saying not to get a mammogram. You're saying no guidelines, risk factors, and do self-breast scan. That's exactly what I'm saying, Susie. Like I always with my shows, I'm always just trying to inform you of everything that I possibly can so that you can make the right decision about your body. Absolutely, Susie. Thank you so much for that. Okay, so what if you don't want to get a mammogram? You want to wait until you're 50, but you're a little bit concerned. You're still like a little bit kind of concerned, like, what do I do here? Well, there is an alternative. I don't know if you've ever heard of thermoscans. Thermoscans basically detect heat in your body. They actually, some places like will just do breasts, but some people will actually do your whole body. Now, this is not something that is quote unquote FDA approved or insurance approved. It's not an approved mammogram screening. But a lot of people, so you're going to have to pay for it if you want it. But the whole thought process is that if the scan detects heat, that means that new blood vessels are being developed and that there's a possibility that could be leading to cancer. Now, there is some research in regard to thermoscans, and thermoscans, they are saying that they can detect it way before mammograms. So that is an alternative. It's an alternative. I personally have not had one. I've thought about it many times. But sometimes I'd be seen to be too busy to actually go and actually look for it. But usually, typically, if you want to get a thermal scan, just do a Google search, thermal scans near me, and typically I know that there's one around here, but especially if you're near a big city and stuff like that, you probably will have that. And they actually can offer doing a thermal scan of your whole body as well, so that you can know if there's any of those kind of risks. So hopefully that clarifies mammograms for everybody. Yes, I know, Susie. Susie, thank you so much. I'm so excited that Susie's here watching us. So does anybody have any questions in regard to mammogram screening? If you do, let me know. Put a question down. I love talking about everything, all of these things. Love it, love it, love it. So if you have any questions, if you think of questions later, please comment them there below. Message us on our Facebook page, however way you want to get in touch with us. I'm more than willing to actually answer all your questions when it comes to mammograms. Okay, so let's talk about pap smear screening guidelines. They have definitely changed over the years. A lot of us young folks used to have to go get our pap smears every year. And it's got to be like about 10 years ago, a little over 10 years ago, that they actually changed them. And they changed them based on research. Research shows this whole thing, which this could be another whole kind of, I actually did a show on HPV, but they changed the guidelines because they know that, so let's first say that, let me first tell the guidelines. So we do not start pap smears until anyone is in 21 years of age, regardless of when you started having sexual relations, okay? Because let's just suppose you're 19 and you started having sex, okay? Even if you're exposed to HPV, even if you have any kind of abnormal cells, in all likelihood you're going to repair all of that completely on your own. It is very, very rare for people to get cervical cancer that young, okay? Cancer is a very slow growing process. So, you can have all the precancer stuff, but actually to get to that cervical cancer spot, it typically is a very slow process. So we wait until you're 21 years to get your pap smears. Then from 21 to 29, you get them every 3 years. And that's just a plain pap smear, okay? As long as you keep getting normal, we're just going to keep going on every 3 years. Once you become 30, we do PAP and HPV, and we do that every 5 years. Now, if you've had, and we do that until you're about 65 years of age. That is, again, this is for someone who keeps having normals and everything is hokey dokey, okay? Then everybody, there's other people, different kind of scenarios. That could be a whole hour conversation, okay? But these are for people who keep having normal. If you've had a hysterectomy for benign reasons, meaning like sometimes people get them because they have fibroids or typically that's a nice benign thing that people have hysterectomies for. You don't need them anymore, okay? They're actually, if you have had a hysterectomy for a benign reason, your chances of getting vaginal cancer at that point, because you no longer have a cervix, is 1 in 7 million. That's a really, 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 really low risk, okay? So those are the guidelines. Now, the other question a lot of people ask is, so if I don't need a pap smear every 3 years or every 5 years, do I need to go to the gynecologist every year? Like, do I need to go get, a pelvic exam? What do I need to do? And again, this is, when you look at the different organizations, they all kind of say a little bit of something different. ACOG, of course, is going to say you need to have a pelvic exam every year because you'll put the gynecologist out of business. Who said that? I didn't say that. Anyway, and then there's other organizations that say, because there's research of saying, by doing routine pelvic exams, let's weigh the risks versus the benefits. Do we really find abnormalities there? And I can say personally, and I've been doing this for a long time, I have never have found cancer, something very, very dramatic, by doing a routine pelvic exam. Have I found a cyst on an ovary? Yes, it comes and it goes. We all have them. Fibroids? Yes, they're very benign. They weren't bothering the patient. We don't do anything with them if you do have them. Very rare can a fibroid become cancerous. There's a certain kind that can, but it's very rare. It really doesn't happen that often. So what is a girl to do? Is she supposed to go, like her gynecologist is saying, hey, I need to go there every year, but do I really want to? I tell people that it's up to you, to be honest with you. I've worked with people that really hate going to gynecologists. And I've said to people, listen, as long as you're going to your regular doctor and everything is hunky-dory down there, there's nothing really going on. And if you really hate coming to see me, well then, if you want to wait, that's totally up to you. Again, this is your body. This is your life. You are to make the decisions about yourself. Hopefully that makes sense when I say that. I'm just speaking from my personal experience. ACOG does recommend routine pelvic exams. And if you want to do that, I think that there's nothing wrong with that, going in and getting checked, getting your breast, getting a clinical breast exam. Although I say you are more familiar with your breast than I am. I only got like a couple minutes. You have every day, 360, your whole life you have with your breasts. I don't. You know them better than I do. So, yeah, that's how I kind of feel when it comes to pap smears. Definitely do your pap smears. Make sure you get them done. When you don't get them, that's when you can have problems. So absolutely make sure that you get your pap smears. Going every year for your pelvic exams. Again, ACOG recommends that this is what I say to my patients. ACOG recommends that you get them every year. There's other organizations that say, really, do you need to get them every year? That's up to you. I think that's really an individual kind of decision to make. Hopefully that makes sense. And that's about it tonight, guys. As always, I'm always trying to open up your mind and have you learn new things about how to take care of yourself. Hopefully this information was informative for you. Remember, just go over, you watch this over again. If you have questions, make sure that you can write them down below. You can message us on Facebook. I'm more than happy to answer your questions. Go to the Gale risk assessment, check out your risk, talk with your medical provider whether you want to be getting mammograms every year or if you want to just do them every couple of years when you're in your 40s. Definitely I recommend absolutely when you're 50 to follow the guidelines. Now, which guidelines you want to follow is completely up to you. ACOG and the American College of Radiology says every year, but the U.S. Preventative Task Force Service says every 2 years. So that is something that you have to decide based on your family risk, your personal risk, and your personal feelings. Pap smear screenings every 3 years in your 20s, every 5 years after that, if you have no issues at all. Okay, everybody? Remember, Lori from Women's Health on the Go. If you want to get, a lot of women are telling me on the survey, I have a survey in the comments, make sure that you fill out that survey for me, please, so that I know what you want to know, because this show is all about you. It's not about me. It's about what you want to know. So make sure, I'm going to put that in the description. Make sure you fill out that survey for me. If you want to receive a free book, it's a free ebook. If you want to avoid the gynecologist, if you want to learn how to take care of yourself holistically and naturally, get the free ebook. It's free, everybody. It's got great little things in there for you to do that will help keep the gynecologist away. All you got to do is comment free in the comments, and you'll get a message, and you'll get to the link and all this kind of fun stuff to get that. Okay? So thank you again, everybody, for watching this evening. I will see you next week. I think I'm going to be profiling another essential oil, because that was something that people on the survey is saying that they would like to see more stuff about essential oils. So I'm not sure which one I'm going to profile, but I'm definitely going to do that next week. And that's it. Have a wonderful week, everyone. And remember, our bodies matter. Our health matters. So make sure that we take care of ourselves. Okay, everybody? All right, take care, everybody, and have a great evening. Bye-bye, everybody.